Thanks for staying with us. You're still watching Breakfast Central right here on News Central. And we're starting our top story. It's border crossing as Zambia makes COVID-19 jabs compulsory. Now, since early this year, Zambia has seen a reduction in the cases of COVID-19 reported in the country as businesses are getting back to normal operations, while citizens continue to observe the 5 golden rules. A good number of people are going for the jab as it is one of the requirements for crossing borders, and traders are seen to have taken advantage of that. In the Sesheke district, just 4 cases have been recorded since April 18th. Now, joining us live on Breakfast Central is Sesheke District Health Director Peter Manda. It's good to have you join us in Breakfast Central, Peter.
Good morning, News Central.
Good morning. So, you've been at the border. Your residents mingle with travelers. How have you been able to manage the COVID-19 situation?
Thank you very much, News Central. Sesheke district borders Namibia at Katimamuliro border, which is one of the busiest borders in the country. So this puts us at risk of COVID-19 because we receive traders and truck drivers from all over the country and continent at large. So we've put up measures to prevent people from getting COVID-19, where everyone at point of entry is screened for COVID-19. Everyone entering or leaving the country is screened for COVID-19. And then those who are coming in the country, they should provide a valid COVID vaccination card. And if they're not vaccinated, we ask them to provide a valid PCR card, which was taken within 72 hours. Other measures which we have put in is we provide, all our health facilities are providing mandatory vaccination to everyone in the district who's free to get vaccinated. We also provide testing for all those who are coming in with signs and symptoms of COVID-19. We test for COVID-19 just there at the border and at all our health facilities. We also continue sensitizing the community on the 5 golden rules, as well as the importance of vaccination. We're also engaging our stakeholders, especially our traditional leaders, the importance of vaccination, because most of the people, they really listen to the traditional leaders. So when we involve them, it helps us get a huge number of our people vaccinated and be prevented from COVID-19.
Okay.
We also provide disinfection to most of the buildings, especially public buildings, so that we prevent spread of COVID-19. Thank you very much.
All right. Peter, but I mean, all of this that you're doing is very commendable, I must say, very, very commendable. But do you agree with the statements that people are making that people are only getting the jab so that they can cross the border? Or does this strategy actually work for your ministry? Do you think this strategy is something that your ministry is working on?
Thank you very much. On that one, I disagree that they are getting the vaccine due to crossing the border, but that has been an added advantage for us. I would proudly say that Sesheke district is the first district in the province to reach 45% vaccination target of our eligible target, of which our target by June 2022 we want to reach 70%. We have achieved this by doing community outreach, where we follow people in their homes and vaccinate them from there. With this, we've seen that we are able to capture a wide variety of people and waiting for them to just come to a vaccination site. With our neighboring country, which introduced that anyone entering should have a valid vaccination card certificate, it has added to our advantage because most of our people like to cross to Namibia and do their trade there. So this is an added advantage, but we can't say that it's the reason why people are getting vaccinated.
Okay, Peter, the country's Ministry of Health has encouraged members of the community to observe the COVID-19 and malaria symptoms, especially as the winter season approaches. Do you see the coming season as a major concern for your people?
Thank you very much. Yes, in Zambia, as we see, winter is about to come. And when it gets caught in almost everywhere, we tend to have a lot of respiratory infections, and COVID is one of them. So I see a rise in having COVID-19 cases in Zambia at large. But we've I've noticed that we've lost guard as we've seen that the cases have reduced and people have lost the guard which we had in the previous 2 years. But we have continued sensitizing the people because information is key in the prevention of COVID-19. We've continued letting our people know that COVID-19 is not yet over. So all those who are even coming with malaria-like symptoms, our first mandate is to test them for COVID. Uh, Thank you very much.
All right. Okay, Peter, finally, I mean, your district is doing well to manage the situation, and every staff indeed is also involved in from the medical field. What is it like when it comes to remuneration in terms of staff being taken care of for the services that they offer? We do know that some African countries are still battling with taking care of staff strength and also involvement in ensuring that there's safety. What is it like in your country and in your county as well?
Okay. Our government has done a lot for our staff, staff in prevention of COVID. Like I say, we're being trained first of all to how to manage our COVID patient, and the government also provide us with PPEs every time we're handling COVID-19 patients. As I speak now, Ministry of Health has sent some staff just here in our district in preparation for the coming winter, being trained on how to best handle these COVID-19 patients and cases when we have them in a district. As well as the government has also put a small risk amount for all health workers who have been exposed to these COVID-19 cases.
All
Thank
right.
you very much.
All right. Thank you so much. Thank you so much for joining us, the District Health Director, Peter Manda. Thank you. And keep up the good work. This is indeed encouraging.
Thank you very much.